Hello, my name is Dr. Becca Schwieter and I am a veterinarian here at Animal Medical Center in Galesburg. And this is Junie, and we're going to be doing her Bordetella, so her kennel cough vaccination today, and she's also due for her physical exam. So when you come into the vet, the first thing they're going to do after the history is do a physical exam of your pet. So I'm just going to walk you through that today. So I start with the face, so I look at them, make sure their eyes are clear, that their nose is clear. I take this time to look at their teeth too, make sure that they don't have any dental disease going on, either in the front or the back. Kind of open their mouth too to make sure the back of their mouth is okay. Then I go ahead and look in the ears. Let's see, her ears look really good today. If there is anything wrong with the eyes or ears, I do use these tools to look in there. So I'll use this to look in the ear and see the eardrum, see the ear canal, if there's any evidence of infection. One time I saw something stuck in there, so that was interesting. And then as for the eyes, I will use this to be able to see the eyes better, see the pupils, see them if they're dilated, if they're constricted. I can look in the back too to see their optic nerve and their lens, any cataracts, and her eyes look great. So then I move on to the belly. Go ahead and stand them up and feel their belly. Make sure I don't feel anything abnormal, any pain, masses, anything like that. And her belly feels really good. And I'll feel her pulses back here. She's got really good muscles. And she's got nice strong pulses. Then I go on to the lymph nodes. We got our mandibular lymph nodes here, our prescapular lymph nodes. These ones you can feel normally, so make sure they're normal size. Their popliteal lymph nodes here, those are normal. Axillary and inguinal lymph nodes you should not be able to feel on a normal exam, and I cannot feel hers, so that's really good. Okay, then I'll look at the skin. Make sure there's no parasites, fleas, ticks, dry skin, anything like that. And then for a very important part is to listen to the heart. Okay, she's got a good, steady, normal heart rate. I'm listening to this to make sure there's no murmurs, make sure that, it's not abnormal arrhythmias or anything. And she sounds really good. A lot of dogs have a fast heart rate at the vet, but that's just because they're a little nervous. So we're also going to listen to the lungs. Make sure there's no crackles, wheezes, anything like that. We're going to listen on both sides. You got to breathe for me to listen to this side. There we go. Okay. Sounds very good. And I've looked at her legs and everything. And last but not least, we gotta look at the butt. Okay, nice clean butt. All right, and on her physical exam, everything's looking really good. So we'll go ahead and do her Bordetella vaccine today. And that is for kennel cough. So you're definitely gonna wanna do this if you do, a lot of boarding, grooming, dog parks where they're exposed to a lot of other dogs. So basically, kennel cough is a respiratory infection, which is characterized by like a goose honk sounding cough. So if you do hear your dog doing that, always bring them in and we can make sure that they're not sick. But here we go. This one's in the nose, so they don't really like it. But 1, 2, 3, go. Oh, I'll give you a little break. They should get all of it, but sometimes they sneeze a little bit out. So, and she actually got most of it in there, so she did really good. Again, let me know what videos you'd like to see and have a great day. Bye, Junie.